Kids face so many changes as they near adolescence. One is an increased risk for disease. I'm Kendra Williams from the Health Department. The protection your kids received from childhood immunizations can wear off as they grow older. Teens should be vaccinated against diphtheria and pertussis. They should also get a tetanus shot, which protects them from bacteria that enters the body through a scratch, cut, or wound. Meningococcal vaccine will protect teens against a serious bacterial illness that causes infection of the fluid surrounding the brain and spinal cord. Girls 9 or older are eligible for the HPV vaccination, which offers protection against the virus that causes 70% of cervical cancers. Parents may also consider getting their teens vaccinated or booster shots against hepatitis A, hepatitis B, measles, mumps, rubella, chickenpox, and seasonal flu. All vaccinations that are required for school are provided by the Health Department at no cost. To learn more, visit springfieldmo.gov/health or call 874-1220.